Hello everyone, I am Dr. RMD. I just recently completed my MD Pediatrics from PJMR Dr. RML Hospital, New Delhi, and I am the apt person to discuss the survival tricks for during residency. So, first rule of residency is survival, just basic survival, nothing else. Don't think that you're going to overwork or whatever toxicity is, nothing. It is just about survival, nothing else. I'll tell you how. How to survive during residency? First rule is don't overwork because no one expects overworking from you. You're only expected to do whatever is assigned to you. Second, don't physically exhaust yourself because, for example, instead of climbing stairs to save your time, you can use lift because at the end of 24-hour shift or 36-hour shift or maybe even 48-hour shift, you are supposed to stay physically active. And third is get sleep whenever possible. Don't think what your seniors are feeling. Don't think that if I sleep my seniors will feel bad, or how can I sleep when they are not sleeping. No, whatever your share is that you do, because being a first year, you are the one who is going to do majority of the work. You are the backbone of your institution. Fourth is learn language or culture quickly. This is true for those who are taking admission in other states or other regions. Next, keep chocolates always in your pocket, especially true for clinical branches because you won't be able to have time to have lunch or breakfast or anything. Just keep chocolates in case of emergency. Next, suppose you have duty for 36 hours. So plan your routine well in advance, because if you plan your routine well in advance, only then you will have necessary things. For example, especially in Delhi and North India for winters, you should, if you're from South India, this is basically what I faced, just take a kettle with you, a small kettle of half liter, because you won't be accustomed to winters over there. So you can just have that kettle to warm water before, during your duty hours, or else you'll be harming your health. So health is very important, okay? Next, take help from your juniors. But be sure that these juniors can abuse you also. They can misuse your initial 1 to 2 months, telling that they'll make you do their work. So you should be smart enough to make them work under you, okay? And as soon as possible, understand how system works. The easier you understand, the better it is. I have seen people, especially my juniors, who take time to understand system. And those are the people who find it difficult to adapt also. So early adaptability is the key to survival. So the fastest one to adapt always survives, okay? So there are certain realities that you won't be aware of right now, but once you enter into residency, then it will struck you. Like first is you will be clueless, because department is like a stream of flow. It's like a river, okay? It will go on at its own pace and you are the one who is entering it. So you don't have any idea regarding what is going on. So initially you will be stuck there. You don't know what is happening. So just go with the flow. Don't expect anything from anyone, okay? Second is you might feel homesick. Initially for 2 to 3 months you'll feel homesick. First 3 months are the toughest to adapt, okay? Keep this in mind. If you survive first 3 to 4 months, then rest 3 years will go like anything, okay? You won't even remember, okay? So even for me also, like initial 3 to 4 months was very difficult to adjust, because there will be many problems. Like one is if you change your residence, then you will have to find rooms. There will be many problems related to that. Initially you won't get hostel. I also didn't get hostel initially. I had to stay outside. There is rapid shift from your culture, from your region, from language. You need to get to know people and all, and lot is expected from first year PG in the beginning itself, okay? So if so you will have a lot of problems to face in first 3 months, and the next is you will think that you will get all hands on. You will get intubation, you will get central line procedures, you will get surgical hands on. Initially don't expect anything. Initially first thing is get to know how a hospital works, get to know how department works. Next, initially you are less efficient, so you'll go late. You might go home at around like 8 o'clock, 9 o'clock. Even though you can finish your work by 5 or 6, you may not be able to go because you are not efficient. So these are the realities that you will face, okay? But gradually what will happen is you will identify your friends, you will get to know your seniors, you will become more efficient, and with the flow you will develop all these skills and all, okay? So there is no worries. Even my first intubation, my first central line was towards the end of first year. I was very patient enough to wait till then, okay? So you don't worry, you will get all procedures, and by the end of like third year, I was teaching my senior residents how to insert central line and all, okay? So you don't have to worry regarding it. Next, there are some bitter truths regarding residency. One is residency is hell. It is the worst phase of your life. There can be nothing close to residency, okay? Just imagine this is going to be the worst phase, okay? You have to accept it. Next, it is toxic. Residency is toxic. You can't have a non-toxic residency, okay? And third is people are selfish. That is what I have also realized. Most people will try to dump their work on you. Even your co-pages, even your juniors, your seniors will always try to dump your work on you. You should be smart enough. Next, you will feel lonely at times, okay, because if you are from like far away state or you are not a resident of that state or and all, you will feel little bit lonely and stranded because you are new to the environment. It is common, everyone has faced it, okay? And your personal life will shatter. Believe me, I have seen many people undergoing breakups and all during their first year of PG. That is because you yourself don't have time to give for yourself, okay? And relationships suffer, your health suffers. Make sure that your health doesn't suffer. I have seen everyone, the direct marker that the like best marker that you are working in residence is you will have weight loss of at least 8 to 10 kgs in your first year of PG. If that doesn't happen, that means you are not working properly, okay? And next, you will regret. Even I regretted for during initial few months, I regretted decision of taking my branch in such a far away place. But after 3 to 4 months, once you get adjusted, now I am like so happy that I had taken pediatrics in Delhi, okay? So these things you will have to accept before you join your course. Next, what is expected from a first year PG or first year resident is only these 5 things, nothing else. First is reliability. What is reliability? Reliability means if some work is given for you, they can depend on you. Like seniors will have a lot of other tension, they'll have a lot of responsibilities. Like a second year or third year or a senior resident will give you some work which you are supposed to complete. Okay, you just need to complete them and show them, yes, it is done. They can rely on you. Okay, that is called reliability. Even consultants will also expect that reliability from you. As a first year resident, suppose you are in a surgical field and you are expected to finish all this pre-surgical workup and all, okay, pre-OT workup. So you should do that. That is called reliability. Second is accountability. Accountability means something is told to you and you should be there to answer for that. Okay, for example, if some sample of like let's say TriDot is sent, see your senior told you to send it, and you should be accountable. You shouldn't be like, yes, I have sent it, next shift someone else came, I don't know what happened, like that. No, you should tell what happens after that. That is expected from you. Third is punctuality. If the duty is at 9 o'clock, you should be expected to come at least 5 to 10 minutes earlier. Okay, so that is like good work ethics. Okay, this is nothing like toxicity and all. This is a good work ethics, because I have seen many of my juniors who come late. Okay, like senior will be coming at 9 o'clock. Everyone is supposed to come by 9 like within like 9:05. Okay, that was the trend in our department. But some juniors used to come at 9:20, 9:30, like everyone has come, work has started. Okay, so that is not expected from a first year. Okay, and next is responsibility. Like you are given a responsibility of a patient, you are supposed to complete that and then go. Okay, that is responsibility. It's not like it's too much. It is the basic thing what is expected out of you. And fifth is humility. Humility means don't cross question your seniors, don't cross question your consultants and all, because as a first year resident, no one actually cares whether you you have extra knowledge or anything. No one cares about your extra knowledge. No one cares about what extra things you are doing. Everyone cares a basic thing, basic etiquette, basic work ethics, and these 5 qualities. Nothing else is expected from you. Okay, so if you even if you overwork also, no one cares. Okay, no one cares. In addition, they will dump their extra work on you. Okay, so just do what you are supposed to do, nothing more. Okay. Next, always work is not toxic, people are toxic. Okay, this is the second rule of residency. Whatever anyone tells, may it be your co-pages, may it be your faculty, may it be your consultants, may it be your senior residents, or even sometimes your juniors also, just hear from one ear and leave it from the other. This is the golden rule of first year PG. Okay, nothing else needs to be done. By the time you come to second year, third year, you will get automatically accustomed to it. Next, these things are meant not to be compromised. Never compromise on your family. Even if you are on duty, take 5 to 10 minutes. No one is going to die in 5 to 10 minutes. Take 5 to 10 minutes and just talk to your family. That is a must. Never miss on this. Next, relationship with your seniors and juniors, maintain it good. You can't scold your juniors too much, because then they won't work for you. And you can't have an argument with your senior, because seniors are the ones who teach you. Okay, they'll teach you, they'll guide you. They are the one who gives you procedure. Okay, sometimes they might scold you, but don't tell anything back. Okay, if they are very toxic, yes, you must be bold enough not to not to suffer from toxicity and not to suffer from unnecessary, because there are seniors whom I have also seen who unnecessarily create a mess, unnecessarily create toxicity. For them, you should be bold enough to answer back, but not always. Okay, just see what is in your limits. Okay, that much smartness you should have. Next, friendship. Don't suffer friendship. Even if you have close friends, your best friends, always make a habit that once in a month you call them, because that will create a sense of mental well-being in you. You'll feel happy. Next, health. Take sick leave if you are sick. Don't compromise on your health. It's not like you wear cannula and do duty. Never, never, never. Because at the end of 3 years, believe me, I have also experienced this. No one cares what your health condition is. Even if you're going to die tomorrow, also still they will call you for duty. Okay. So don't compromise on your health. If you want sick leave, take sick leave. You can do extension later on. Doing extension is PG is not a big thing. You can do it later on. What I have seen is in majority of the cases, extension doesn't happen, and even if it happens, you'll have to do along with your junior, so it doesn't matter much. Okay, so don't ever compromise on your health, and ask for help anytime you need. You can ask help from your seniors, you can ask help from your friends, you can ask help from your parents, you can ask help. I have seen what happens always is during residency, you have this fear that your bond penalty, seat living penalty is an issue. Okay, so that never becomes an issue. I'll discuss about it later on. Okay, so what not to do: never engage with faculty. Okay, never engage with any issue with faculty. Don't fight with faculty, because they can make your life hell. Your seniors can't make your life hell, but your faculty can. Next, avoid tussle with seniors as much as possible, because they are the ones who will be there along with you to guide you. Okay, so sometimes what happens, even as a senior, there will be a lot of responsibilities. They might scold you, and they might tell you something. Just hear it and let it out. Okay, don't ever go into a big mess with the seniors. Okay, then don't ever mess with interdepartment issues, because if it is interdepartment issues, always it goes to the notice of HOD. So don't ever get caught in that. Next, this is a personal advice, okay, regarding delaying marriage and pregnancy, because residency is already a hectic thing. Okay, it consumes a lot of your efforts, so it's very difficult to deal with it. Although I have seen people who have balanced all this, but still it's better to avoid. Next, life-threatening habits. I have seen many people who indulge in binge drinking and drug overdosing and all. Okay, even deaths have happened because of it. So don't do this, because you are going to get some moments of satisfaction with this. Okay, never, never. Next, what are the other things you shouldn't do? Don't overthink. I have seen many, especially female PGs, who overthink a lot because of some minor issue that's happening. Okay, for boys I have seen they are very chill, one or the other, they'll have friends and they'll talk it out. But females I have seen they'll be overthinking regarding small issues, so don't do that. Next, if you are panic, always ask for help. Okay, you are not alone in the whole hospital campus or in and around the community. You will have people who are ready to help you. There are always resident doctors associations who always you can approach. Okay, next, don't buy app for NEET SS preparation in your first year itself. Never, never, because this is not going to help you. You are there to become a doctor. You are not there to crack MCQ. You are not, patient doesn't come here with 4 options of MCQs. Okay, so don't buy any NEET SS app in first year itself. Next, always any procedure you are doing, maybe made with suturing, made with wound cleaning, whatever it is, simple procedures such as cannulation, always do it with gloved hands. Okay, always take precautions, always wear a mask, because I have seen people affecting with deadly diseases like tuberculosis during their residency. Yes, so always take precautions, and always take personal precautions also. Okay, and don't miss any outings, trips, parties, conference. No matter your post duty, just attend it, because you are not going to get that time back. Okay, one important thing about bond penalty is this is, I was talking to a high court lawyer just before I came back. Okay, and he told me one important thing, that bond living penalty, many people leave the state thinking that you have to give bond living penalty, but always the government and the legal system is in the favor of students. Okay, if there is something very bad happening, like toxicity is dealing so much on your health, or you had a very bad experience at your college, you can actually leave seat, and bond penalty doesn't become an issue. Okay, if you go along with the case in the court, court can actually exempt you from paying bond living penalty if the bond penalty is very huge. Okay, so you don't have to worry about that. Always take legal consult before taking such decisions. Okay, so residency is actually fun if you know how to enjoy during residency. Okay, it's not like always it's work. There are many situations even in my life during my residency where even I feel that after residency was such a good time, despite there were so many things, there were ups, there were downs and all. Still, at the end of 3 years, I just remember whatever good times I had during residency. I don't remember what duties I had to do, and what the toxic seniors and I had. All those I don't remember at the end of 3 years. At the end of 3 years, I just remember how well I enjoyed with my seniors, with my juniors, with my co-PGs, and all the good time I had over those 3 years. So make it worth it. Okay, and all the best for your residency, those who are going to start. Thank you.